In Chapter 5, we will study anti-anginal drugs. Anti-anginal drugs have one purpose, not only to fight angina, but certainly to prevent our patients from developing the irreversible injury to their heart muscle, the myocardial infarction. This chapter really will deal primarily with nitrates, particularly the drug nitroglycerin. We know that angina is the actual principal syndrome of ischemic heart disease. Really, the majority of patients present with what we call stable or exercise-induced or classic angina. The etiology of this disease that affects the coronary vasculature is atherosclerosis of the vessel and potential occlusion because of a superimposed thrombus to the atheroma plaque. Classic location, as we know, is the left anterior descending coronary, where 45% of the blockages tend to occur. Right coronary artery, which can actually be as often as 30% of cases of ischemic heart disease, and circumflex, which potentially would involve upwards of 15% of most ischemic events. Another possibility for angina is vasospastic or variant angina. This is an important angina to have in mind. Although a minority of patients would have Prince-Metal, this has nothing to do with atherosclerosis and will require potentially a different management of this patient. Prince-Metal is really a reversible decrease in coronary blood flow secondary to a coronary vasospasm. The drug strategies are pretty logical. Let's increase oxygen delivery by decreasing vasospasm. Drugs that dilate well coronaries could include nitrates, calcium channel blockers, or let's simply allow our heart to function at a lower metabolic rate. Let's decrease its oxygen requirement so it becomes more resilient to hypoxic injury. Best job to decrease oxygen requirement of a muscle is to use drugs that decrease its workload. For instance, decreasing the afterload by dilating arteries could be a possibility. Only problem with this approach, the potential that hypotension could result in a reflex tachycardia. So reflex tachycardias would have to be prevented by the addition of a beta blocker. Try and decrease contractility of the heart. This would be achieved with beta blockers once again, or try and do both. Now, if beta blockers come to mind for this, nitrates also belong to that group, as we're about to see, and certainly certain calcium channel blockers would perfectly fit this scenario.